Welcome back and thank you for being with us. This is Khalil Hashim. The number here is 248-557-3300. Give us a call if you have a comment or a question. And, we were talking to David Mastunin earlier from the school district and to get an idea of how the school year is going to be. And as you all know, COVID is still part of our life and still evolving. And with us this morning, Dr. Zahir Sahlul will give us a COVID update and discuss monkeypox emergency, which is another emergency that we're dealing with nationwide. Dr. Sahlul is a pulmonary and critical care specialist based in Chicago and an advocate to protecting civilians, children, healthcare workers, and human rights and refugees in war situations. Dr. Sahlul, good morning. Thank you for being with us.
Good morning, Khalil. Thank you for having me.
Absolutely. I really appreciate it. Thank you for waking up a little early in Chicago so you can be with us.
Oh, you're welcome.
Absolutely. So what's new? I mean, COVID has been evolving. I notice more and more people getting COVID, but they're not as affected. Please give us an update. What are we dealing with now and what we need to do?
This is a very important topic because we're still in the midst of a pandemic. As you've mentioned, there's millions of people throughout the world who are infected with COVID-19 on a daily basis. In the United States, we have still, unfortunately, a few hundred people who are dying every week because of COVID. Right now, we have about 1,040,000 people who died in COVID in the United States since the beginning of the pandemic in early 2020. Overall, in the world, about 15 million people died. It is weaker, as you have mentioned. The virus has evolved, adapted to the people, and this is the way how viruses evolve. And now it's becoming more infectious and less virulent. That means it spread faster, especially the new version of the virus, the B5 Omicron, which spread much faster among people, but it's much weaker. Many people actually get infected and they don't know that they are infected, but they can still spread the virus. And the reason for this weakest version of the virus or strain is because we have a higher level of community immunity because of the vaccination and because of the infection that happened over time. Mm-hmm. Most people got infected or vaccinated, and that's why we have this less virulent part of the virus, and because, of course, of the mutation that happened to the virus over time. And the CDC came recently with the new recommendations that are different than the original recommendation that are dependent on the risk of people to get infected. So we don't have of course, the mandatory masking. We're not hearing anymore about the social distancing or changes in the work or school or work environment. So people are going back to their lives. But the new recommendations are more dependent on how to ventilate indoor areas better, how to wear masks when you get infected, how do you isolate yourself when you do home testing, which we have not done in the beginning, of course, of the pandemic. So most people right now do home testing, and if they're infected, then they have to isolate themselves for 5 days, not more than that most of the times. And also there's availability of many medications for either prevention or treatment. So these are kind of the new changes in the COVID pandemic.
Absolutely. The numbers could be much higher since, some people are not even reporting that they have COVID, The numbers could be much, much higher. So.
We still have very high numbers, more than 150 to 200,000 people get infected every day. There was a recent study that showed that most people who are infected are not symptomatic. So that means that the numbers, as you said, are much higher. Yesterday in the hospital, I saw 3 patients with COVID who are in the hospital, who are there for different reasons, but we tested them and they happen to have COVID. Of course, we put them in isolation, but they're not sick the same way that we've seen patients early in the pandemic.
Sure. The question here is, the virus is not strong. However, people still dying of it. Are those because of complications in their bodies, or what it is?
That's a good question. Still, the virus is dangerous. That's why people who are still not vaccinated, they have to be vaccinated. And people who are vaccinated need to be boosted. Nowadays, We have more studies that showed if you are vaccinated, then you are protected. And if you are vaccinated and boosted, this is better than just vaccinated. I mean, that will provide you protection from death and from severe disease. Even it will protect you from having chronic COVID, which now are dealing with long-term consequences of COVID. So 5 to 10% of people will continue to have symptoms even after they recover. So vaccination will protect you from these chronic symptoms. So vaccination is still important. And also people who are immunocompromised because of cancer or because of getting medications that suppresses their immunity for kidney transplant or other transplants, or because if they have an underlying disease that affects their immunity. These are people more susceptible to death and severe disease who end up in the hospital on the ventilator and may die. Also, older patients, even if they get vaccinated, they have a higher likelihood of contracting severe disease and dying. So these two groups of patients, older patients and patients who have who are immunocompromised.
Yeah, you know, for the fall, normally we get the flu vaccine, and now we're going to have the flu vaccine, and we may have, they're talking about a booster for the fall. Do you recommend people take both, or are they going to be merged together? What's going to happen in the fall?
That's a good question. I'm not aware that we will have a version that will have both the influenza and the COVID-19 vaccine together. It may happen, maybe not this year, but in the next year or so. There's talk about, of course, the new booster that incorporates the B5 version that I've mentioned. That is not included in the previous vaccine and boosters. So that means if you get boosters with the next generation of the vaccines, then you will be protected from the current dominant infection of COVID or strain of COVID, the B5.
Absolutely. You know, you kind of answered this question. We got one from online. It says, why still people who had 3 shots still go to the hospital?
Yeah, I mean, I mentioned that unfortunately immunity that we are getting from the vaccine, and also natural immunity, wane over time. That means it gets weaker over time. That means the new virus will hit you even if you got infected and boosted. But you are protected more from severe disease and from death if you are vaccinated and boosted. And also because the virus keeps changing. And the current virus is totally different than the original virus.
Sure. You know, a lot of people don't understand is that you know, the vaccine is not to prevent you from getting COVID, it's to prevent you from dying of COVID and getting into more severe complications. Is that correct?
That's correct. Although the vaccine does protect from even mild illness in majority of people, it doesn't mean that everyone who gets vaccine will not get infected. But does protect in general from all infection with COVID virus, but also it protects especially from severe disease and from hospitalization related to the virus, from death, and from chronic symptoms related to the virus.
Absolutely. The message is still get vaccinated, get boosted. That's the best way. And practice healthy habits as well. You know, washing hands, and, you know, if you're going to be inside, you know, when I put on a mask, that's perfectly okay.
Excellent. I mean, these are very general recommendations right now. You know, if you get infected, don't go out and spread the virus. Isolate yourself for 5 days. Use the mask. If you are exposed, use home testing to test yourself. And if you're infected, even if you don't have symptoms, isolate yourself. Sure. If you're inside a place that you can improve the ventilation. These simple measures can make a long way in improving and stopping the spreading of the virus.
Absolutely. To a different topic, which is the monkeypox. I mean, it doesn't seem to be as serious, but it's still, it still infects people, and it's very painful and doesn't look good. What do we need to know?
It is an international public health emergency, according to the WHO. We haven't heard about monkeypox a few months ago. The first case that was reported in the United States was in May, and now we have more than 14,000 cases that were reported, and this is probably the tip of the iceberg. It's a disease that has been there for since the 50s, but it was rare in some Western African countries that transmitted from animals to human. It can cause, of course, skin rash that are painful. I mean, we're probably, my generation and your generation are familiar with the smallpox. We used to get vaccinated for smallpox, and that's why we don't see it anymore. It's from the same family of viruses. It can cause painful skin rash and fever and enlarged lymph nodes. It may last for 3 to 4 weeks. The death rate is very low. In the African version of the virus, it's probably about 10% or less than that. But here in the United States, and this version of the virus that also mutated from the original virus is much less. So we haven't reported any death in the United States. But it is a disease of concern because the virus also may change its behavior. We know that it changed its behavior and now it's spreading through sexual contact, which is a new thing. Used to be transmitted from animal to human, from rodents and monkeys to human in Africa. Now it's transmitted from man to man through sexual intercourse. The majority of people who are affected are men who are homosexual, who have multiple sexual partners, and that's very worrisome. And that's why the vaccination now is targeting this group of people, homosexual men who have multiple partners. And the Biden administration has made the vaccine, which we're lucky actually that we have this vaccine available for about 400,000 people, and they're producing more of the vaccine to vaccinate about 1.8 million people or so in this country.
Wonderful. Is there anything I haven't asked you in regard to either one, COVID or monkeypox, that we need to know?
I think it's important to, if you are exposed to someone who has monkeypox, also to look for the symptoms that I've mentioned: fever, enlarged lymph nodes, skin rash that are painful, that start in the face then spread to the body, and to protect yourself, of course, if you are homosexual, by avoiding sexual intercourse with men. A vaccination is available, so get the vaccine, and also isolate yourself because the virus can also be transmitted through droplets, through breathing, and also from contact with the skin lesions, not only sexual intercourse. So these are important things. And also look for the information and believe the information. These are not conspiracies, and science is telling us that these viruses can affect people, and we have more data about both COVID and monkeypox. Unfortunately, we are living in a world that we will have more and more of these new infections because of the interaction between men and animals, and also because of the way that we are living right now. That is different than few decades ago, when there is not much interaction and travel and so forth.
Absolutely. Dr. Sahlul, I want to thank you so much for being with us this morning. We really appreciate all this information.
You're welcome, Khalid. Have a nice day.
Thank you so much.